At the onset, let me dedicate the entire course to my God, Almighty Sri Ayyappan. Happy New Year greetings to all of you over there from Positive PG Medical Entrance Exam Training Center at Chennai, Madurai and Tirunelveli. This session is basically an introductory session regarding the NIMHANS crash course which Positive is planning in the month of March 2014. At the onset, I should welcome my young budding neurologists, neurosurgeons and psychiatrists over there. This time, since the exam date was preponed by 3 months, most of the candidates preparing for NIMHANS would have been caught unaware. Their preparations might not be as satisfactory as they expected. So we thought we'll try to bail them out with Positive NIMHANS 2014 program, which is a tailor-made program in a short duration. We have tried to cover all the salient points which might be asked in NIMHANS March 2014. Now I'll just explain regarding the details of the crash course from Positive NIMHANS 2014 course. It's a crash course for NIMHANS 2014 at Chennai. It's a course for 4 days. The dates are from March 18th to 21st March. It will try to cover all the various aspects which are absolutely needed to top NIMHANS 2014 March examinations. The timing is from 8:30 AM to 7 PM. We will be completing this course around a week before your main exam NIMHANS March 2014, which is on March 29th and March 30th. Coming to the schedule, the first day we will start off with hardcore neurology, which might include some neurophysiology also. Day 2, what is planned is the initial session in the morning will be neuromedicine followed by neurosurgery. A part of neuromedicine is covered and neurosurgery will be covered in toto. Coming to this neurosurgery in specific, candidates who appeared for the last year exam, NIMHANS exam, will know exactly what is required and how tough the exam was, because they were problem oriented questions which the consultant can definitely clear it up. Third day, what we have planned will be the completing part of neuromedicine will be covered in the morning session. The afternoon part will be neuroanatomy, which will be covered there. Coming to the fourth day of the session, fourth day we have planned to sandwich psychiatry and neuroradiology. This will cover psychiatry sessions and neuroradiology, which will be mostly practical, image oriented neuroradiology, so that any tough questions in NIMHANS March 2014 can be answered with ease. Candidates who appeared for last exams will know many questions were asked from pictorial thing regarding MRI, CT and all, which unless you have worked in some wards, it will be difficult to answer. So my consultant will try to put it as practical as possible, so we are prepared for any tough questions asked in NIMHANS March 2014. So we are trying to squeeze in 5 topics: neurology, neuromedicine, neurophysiology, neuroanatomy, neuroradiology and psychiatry. These six things will be the main backbone. On top of it, what else we feel, our consultants feel is required for the examinations, we will try to infiltrate that also inside the course. Now a word about my team. This team comprises of Dr. Manoraj and myself, young budding neurosurgeon. Dr. Meenakshi Sundaram is a consultant neurologist. One more word which deserves to be told here, he is an alumni, he finished his DM from NIMHANS. Dr. Anandakrishnan, he is a consultant psychiatrist. is a associate professor of psychiatry, and Dr. Shivashni, again associate professor of radiology. This is the team which we have. A few points regarding each of my team mates. I just go through my curriculum vitae as far as entrance exam is concerned. What I'll be taking care is neuromedicine, neurology from the 18th edition of Harrison, which is trimmed into the needs of NIMHANS 2014, will be put in for you. Neurosurgeon, assistant professor of neurosurgery, a good friend of us. He'll take care of neuroanatomy and neurosurgery. Only request I made to him is make it as applied as possible, so that simulate a scenario in the wards, and the question should be framed in such a manner that whatever clinical scenario or any tough nuts asked in the examinations, we will try to convert them into peanuts. Then comes the consultant for neurology. He is a consultant neurologist, senior consultant neurologist. The most important point as far as entrance is concerned is an alumni from NIMHANS. I'll call him a live wire, very exuberant, very lively, young, dynamic. He'll be apt for a neurology. All your neurology doubts, clarifications, and he will take it. The course will be tailor-made exactly what NIMHANS demands. My radiologist, associate professor, well experienced in entrance training. The only request I made to them is it should be applied neuroradiology. So the CT scans, MRIs, your Dopplers, carotid Dopplers, whatever they see and whatever might be asked in the examinations should be put in here, so that no area is a gray zone as far as guys who are coming for positive NIMHANS 2014 course is concerned. All NIMHANS oriented areas will be ventured and will be clarified as clear as possible. The final touch is by our consultant psychiatrist, associate professor, very well experienced in entrance training. He is in our part of the regular team also. The most heartening thing about my consultant for psychiatry is he gives a handout. Psychiatry, as we know, we don't have any specific textbook for that. It might be big, it might not be needed for entrance examinations. What was most heartening was at least 80% of questions from AIMS examinations for the past consecutive few years was answered from his handouts. So he'll take care of your psychiatry. This is the entire team which will comprise a nephrologist, a neurosurgeon, a neurologist, a psychiatrist and a radiologist. This team will try to channelize you in the available 4 days towards your destination to become young budding neurologists or neurosurgeons or psychiatrists by March, April 2014 itself. This is the ultimate mission of positive NIMHANS 2014 team. Once we finish this course, what we have is we have planned for 2 online examinations, POLS NIMHANS 2014, 2 online examinations, 1 pre-course, 1 post-course, so that the exact dates will be announced soon. 1 exam you can take it before coming to the course, 1 exam you can take it going back after the course. It will be 3 to 4 days prior to your main examination, so that the entire team will try to contribute. Exactly these questions will help you assess yourself before the main NIMHANS examination. So the highlights: 8:30 AM to 7 PM. Extra attention will be given for pictorial questions, because that is the one area, unless we are prepared for that, even if we prepare otherwise, we cannot touch the questions, and unfortunately these questions are the ones which will decide toppers. As usual, what is the promise Positive makes? Positive NIMHANS 2014 crash course. The entire team works to achieve this, to provide at least 70% of questions, that is around 70 marks out of 100 marks in the main examination. If you can add up your indigenous stuff to that, definitely you can come out as toppers. Positive welcomes you all from various quadrants of this country for Positive NIMHANS Crash Course 2014 to Chennai. Thanks for the patient audience. We are proud and pleased to welcome you again, all our young budding neurologists, neurosurgeons and psychiatrists to Chennai to achieve their target in the shortest time possible and conquer March 2014 NIMHANS examinations. With God's grace, with your parents' blessings and the team effort and your commitment, we hope we achieve this mission. Thanks a lot for the patient audience. All the best, gentlemen. Thank you.